Let's talk about fatty liver disease. Here in South Texas, it's a big problem, and we're actually seeing the numbers of patients skyrocketing across the country with fatty liver disease. Almost to the point where some of my patients come in and they're like, yeah, I have fatty liver, my mom has it. Like it's a casual, normal thing to have, but it's not, and it's actually quite alarming. An example of what a fatty liver would be showing what a normal, healthy liver tissue looks like, all the way up to the most severe form of fatty liver disease, also known as cirrhosis. Now, where this comes important in terms of weight is that the number one treatment that we had for the longest time was weight loss. So we would teach our patients, you have to lose weight, you have to exercise, you have to change your nutrition. Now, there are 2 FDA-approved medications on the market to treat fatty liver disease in conjunction with those lifestyle modifications. One is a product called Resdifra, which actually directly works within the liver. And then there's the GLP-1s. And GLP-1s have been popular for lots of different reasons, but they are FDA approved in the form of injections to treat fatty liver. So when you take a normal healthy liver and you were to look at it, you should just ideally see a nice soft piece of tissue with good, blood vessel flows. In the early stages of fatty liver, or steatosis is the medical word, you can actually start to see the fat accumulate within the cells of the liver and start to cause some congestion. If this is not treated early and aggressively, then you start to see it progress where you get extreme scarring, extreme congestion, and actually a liver that dies. And the only treatment when you get to this point is typically a transplant. The reason this is so terrifying is that you can go from a middle stage like an F2, F3, or a fibrotic liver straight to cirrhosis like this. When you come to see me, that's going to be one of the things I screen for, not just to get you that GLP-1, but also because I want to save your life. I don't want anyone to have to be on a transplant list and go through all the terrible things that an end-stage liver patient has to deal with on a day-to-day basis. In addition to blood testing, there's also actually some types of ultrasounds, fibrosis scans that will actually measure and give you a number, of how much percentage of fat you have within your liver, as well as any degree of fibrosis or stiffness in the liver. Once we have those numbers as a baseline, we can see these reversed pretty quickly. And that's the beauty of the liver, is that when you treat it right and you really take care of things, you can see immediate improvements, both in blood testing and in imaging and just overall health and wellness.